Okay, infectious disease of the nervous system is where we'll start off today. Just a quick review of the nervous system, recognizing the nervous system is composed of primarily the brain as a central organ, and then there are nerves that extend throughout our body. The brain itself is protected by the skull and or the backbone, which typically the skull protects the brain itself, the backbone protects the spinal cord, which actually passes through the skull, through the foramen magnum, down the vertebral column. And so how do microbes invade this nervous system? Well, they can invade the system through the skull, through skull fractures, through back fractures, fractures of the vertebral column. There are medical procedures that can induce bacteria. For example, an epidural, an anesthetic procedure that a needle is inserted to the lower portion of the spinal cord and an anesthetic is injected into the spinal cord to cause anesthesia. However, remember the skin, and we talked about the skin, has normal flora or normal bacteria, normal microbiota that's on the skin itself. And even though we scrub it, even though we clean it, even though we put betadine and all other types of antiseptic on the skin, we can never remove all of the bacteria. And so when the needle is passed through the skin into the spinal canal, you can induce bacteria. And so a person can develop a nervous system infection from that. Or it can be a contaminant. As you get further in your nursing career, you'll learn about aseptic technique and sterile procedures. However, some people will break sterile technique. Accidents do occur, whether this is intentional or non-intentional. And again, by the insertion of the needle into the spinal canal, you can induce a bacterial infection. You can also get injuries from the environment. Rabies, for example, is transmitted through the saliva of certain animals. You can get a bite. That bite migrates. The bacteria of rabies can migrate through the tissue into the nervous system and then in a retrograde fashion back up into the nervous system and cause an infection. And then the blood system, lymphatic system can also transmit infections into the nervous system as well. This just, again, a little quick overview of the central nervous system, starting at the brain, following down the spinal column, the spinal cord itself, and then there are a number of nerves that come off of either at the cranial nerves, cervical nerves, all of the spinal nerves here, thoracic, all the way through lumbar and sacral, have nerves that branch off. And again, certain infections can actually, in a retrograde fashion, migrate and get into the central nervous system and cause problems. Microbial diseases of the nervous system. Well, bacteria can grow in the cerebral spinal fluid, in the subarachnoid space. Those of you who have had A&P2 have already started studying the nervous system, and I know that's what your final exam will be on. But those of you who have not gone through the nervous system, just recognize that the brain itself is bathed in some fluid, spinal fluid. That spinal fluid not only sits in the skull, but also bathes the entire spinal column. And because it's a fluid median, bacteria can easily grow in this fluid median. And even though the infection may be in the lower portion of the spinal cord, or it may start in the brain, it can migrate throughout this complete fluid network and disseminate an infection throughout the central nervous system. The blood-brain barrier typically is a barrier that kind of separates the blood vessels and to some degree the lymphatic system from the central nervous system. So an infection that you may have in the bloodstream, in other words, you get a staph infection in your skin, that staph infection gets into the bloodstream, may not infect the central nervous system because of what's called the blood-brain barrier. This is basically tissue layers that act as super strength types of filters that keep bacteria from migrating into the central nervous system. So the blood-brain barrier, capillaries prevent the passage of some materials, bacteria, but on the other hand, it may also prevent antibiotics that are needed in the central nervous system to fight infections. So antimicrobial drugs might not be able to get through the blood-brain barrier. Now, in those particular cases, what happens, sometimes we have to give antibiotic therapy at much higher dosages because we have to be able to get through the blood-brain barrier to treat central nervous system infections. Those antibiotics have to be filtered through the liver and the kidneys. The kidneys are very sensitive to high levels of antibiotic therapy, and because you have to give such high levels of antibiotics, you can compromise kidney function in an attempt to try to treat a central nervous system infection. The term meningitis you should be familiar with. Inflammation of the meninges. The meninges are tissue coverings. I won't go into anatomy, but again, those of you who have had A&P2 recognize meninges are basically tissue coverings of the brain and of the spinal cord. They can get inflamed. It can be inflammation. Now, inflammation doesn't mean infection, but because we're talking about infectious disease, this inflammation is caused by either bacteria or a virus, and it can lead to a condition referred to as meningitis. Another condition, encephalitis, denotes the same thing. Inflammation in tissue lining, tissue coverings around the brain and central nervous system. Encephalitis typically limits the inflammation to the brain itself, whereas the meninges extend down the spinal cord, and so the entire central nervous system, including the spinal cord, would be involved. Encephalitis typically are related to just the brain. Now, the meninges and the central nervous system, basically this is just a quick review of anatomy. Again, fluid covers and bathes the brain, acts as a cushioning for the brain, a degree of protection, and then that fluid also passes down the spinal cord, as the picture denotes here. There is a barrier that kind of protects the brain from substances that may be in the blood vessels. Again, there are tissue layers, the arachnoid matter, the pia matter. These are all tissue coverings that can help protect the brain to some degree. However, these tissue layers themselves, these meninges, can also get inflammation and lead to meningitis. Some of the conditions you see related to, or some of the signs and symptoms you can see related to bacterial infections would include fever, headaches, stiff neck, followed by nausea and vomiting. It may progress to convulsions, coma. You can diagnose this. You get a sample of the cerebral spinal fluid, which is typically crystal clear, clear as water. However, if it looks a bit cloudy, a bit turbid, typically that's an indication of an infection in the central nervous system or in the fluid that bathes the brain. And from diagnosis of that fluid, analyzing it either under a microscope, taking a sample of the fluid, putting it on a culture medium, and seeing what bacteria grows out, would be able to diagnose the type of infection that's causing the meningitis. Typically treated with antibiotics. The class of antibiotics that's used usually is a cephalosporin, which is just basically a category of antibiotic therapy that can be treated, that can treat significant bacterial meningitis. These are some of the organisms that can be involved in that. Streptococcus pneumoniae, Neisseria meningitis. We've already talked about the gram-negative diplococci that can infect the spinal fluid in the earlier lectures. That would be Neisseria meningitis. And then Haemophilus influenza can also cause bacterial infections. That gives you the percentage of cases. As you can see, the highest number of cases usually falls with strep pneumonia, followed closely by Neisseria. You can see the fatality rates very high with strep pneumonia, but you can also see fatality rates with Neisseria as well. Gram-negative organisms like Neisseria typically make you very sick very quickly. It occurs mostly in children. When we talk about Haemophilus influenza, usually see it in children between the ages of 6 months and 4 years. Gram-negative anaerobic bacteria, normally throat microbiota or throat normal flora, is usually the causative agent. We have Haemophilus that's in our mouth, especially when you're that young. There is an antigen. Remember, antigen is the foreign invader into the bloodstream, or in this case, into the central nervous system. The antigen is the foreign part. It has a particular type of identifying marker, so it's referred to as a capsule antigen type B. Prevented by vaccine, so vaccine can be administered to prevent this type of infection. Neisseria meningitis, we've talked about several times throughout the semester, mainly just to differentiate morphology. But we're looking at diplococci here, gram-negative organisms. It typically has a capsule. 10% of the people are healthy. Nasopharyngeal carriers of Neisseria meningitis. Begins as a throat infection or a rash, serotype B, most common in the United States. And again, vaccines against some serotypes are available, but I have to say some serotypes, all it's not available for. Strep pneumonia, meningitis, pneumococcal pneumonia. You've probably heard of pneumococcal pneumonia. There's a vaccine out for pneumococcal pneumonia that's recommended. Gram-positive, diplococci, 70% of the people are healthy. Nasopharyngeal carriers, again, most common in children, 1 month to 4 years. Mortality rate in children, about 30%, pretty significant. Remember, we talked about smallpox having a mortality rate of viral infection, though, of about 30%, so that's pretty high. 80% in elderly. 80% in elderly. So this is just a near fatal disease if it affects an older adult. And you can see it a lot. It will migrate. Person will get streptococcal pneumonia, and then it will advance from pneumonia until it gets into the bloodstream, and the person becomes septic. Septicemia occurs, and then it can also invade eventually through the blood-brain barrier and infect the brain. If that occurs, the person dies. So 80% fatality in elderly. Prevented by vaccination. Other organisms, listeriosis, also an organism, gram-negative, anaerobic rot, usually in foodborne, can be transmitted through the fetus. So that means it can pass not only through a blood-brain barrier, but there's another barrier referred to as the placental barrier, similar to the blood-brain barrier, a filter that the mother can protect the child from infections. The mother could actually have an infection and the child wouldn't get it because of the placental barrier. However, this particular organism can be transmitted through the fetus, so it can get through that barrier. Reproduces in phagocytes. Remember, phagocytes are the cells that typically would destroy these types of organisms, but this particular organism is a mean booger because it can reproduce inside the cells that typically would get rid of that infection. Another organism that you probably have heard of is tetanus, Clostridium tetani, botulism, gram-positive, endospore forming. You're familiar with the endospore and how that increases the virulence of certain microorganisms. Endospore forming, obligate anaerobe, grows in deep wounds, secretes something called tetanospasmin, released from the dead cells. It blocks the relaxation pathway of muscles, so the person becomes really rigid. That's where the term lockjaw comes from, because of the tetanospasmin that's produced. Prevented by vaccine, tetanus toxoid. You know what toxoids are for and derived from. You also need to get a booster. Typically it's good for about 5 years. On the outset, when we ran short of tetanus, public health officials said, well, you know, tetanus toxoid probably is good for 10 years. But every 5 years you really should get a booster injection, unless they run short again, and they'll probably move it to 10 years again. But treatment with tetanus with an immune globulin, that basically means if you didn't have the tetanus toxoid and you had an active tetanus infection or you got contaminated, you would have to receive the immunoglobulin if there was a high suspicion that you were going to develop tetanus. Does that make sense? So if you did not have an up-to-date tetanus injection and you were exposed to tetanus, and there's a high probability that you will develop the active disease tetanus, you can be treated with the immune globulin. Now, usually you have 72 hours after a cut, after an injury, to receive the tetanus toxoid, and then it would prevent the disease. But if you wait outside the window and you allow this organism to have an opportunity to start multiplying in the system, then you'll have to receive immunoglobulin. And that basically will just boost your immune system. Doesn't mean that you won't come down with the infection, but it might limit the on-course of it. Classical picture of a person with tetanus, the rigidity, muscle spasms so severe that a person can literally break their spine is how it's defined as. I've never seen a case of tetanus. Some of the older guys that are out practicing have said they've seen cases, but I've never seen a case of tetanus before. Microbial diseases of the nervous system. Structure and function of the nervous system. Central nervous system consists of the brain and spinal cord. We already said that. Control center that picks up sensory information from the environment, interpreting activity, impulses, and coordinates muscle and bodily activities. Peripheral nervous system consists of all the nerves that branches from the brain and the spinal cord. These nerves, the blood-brain barrier, again, communication that lines the central nervous system, protects it from the external environment. The skull protects the brain. The backbones, are like the vertebral column, protects the spinal cord. The meninges consist of the dura mater, which is the outermost layer of tissue covering, the arachnoid mater, which is the middle layer, and then the innermost layer is referred to as the pia mater. cerebral spinal fluid, or CSF, circulates in the space between the pia mater and the arachnoid layer. That's referred to as the subarachnoid space. Pia closest to the brain, above that, the arachnoid mater, in between is fluid, or fluid space, the subarachnoid space. Blood-brain barrier consists of capillaries that permit certain substances to pass from the blood into the brain, prevents others from, and will prevent some substances from passing through that. And I remember I gave you the analogy about the antibiotics, that some are not able to pass through the blood-brain barrier. Microorganisms gain access to the central nervous system by trauma. In other words, you get a skull fracture, an open skull fracture, and now the cerebral spinal fluid has access to the outside median. It doesn't take a big fracture. Small linear skull fracture that communicates with the outside, bacteria can easily leak in and cause a major problem. Again, contaminants from needles during surgical procedures can also be a cause. Microorganisms may enter, move along the peripheral nerves by bloodstream and or lymphatic system. Inflammation, the meninges, is referred to as meningitis. Antibiotics usually unable to cross the blood-brain barrier unless you really get the dosages up real high. Bacterial meningitis, three major types. Again, meningococcal meningitis caused by Neisseria meningitidis, pneumococcal meningitis caused by strep pneumonia, Haemophilus influenza meningitis. Nearly 50 other bacteria have been reported to cause meningitis. So it's a lot of bad boogers out there. Meningitis patients complain of headaches. Symptoms are nausea and vomiting, can proceed to convulsions, coma, and even death. Haemophilus influenza we already talked about, often a member of the normal flora of the throat. We see it a lot in kids. Most common bacterial meningitis in children under 4. Incidents have been decreased with the use of a vaccine. And we talked about meningococcal meningitis as well. Gram-negative diplococca. Should be able to identify that. Gram-negative diplococca. I should throw that on the lab exam. Frequent inhabitant of the throat behind the nose. Throat infections can lead to bacteria followed by meningitis. Symptoms are due to endotoxins that's produced by the bacteria. The disease primarily affects very young, already said, serotypes. We also see widespread epidemics in some countries, developing countries primarily, Africa, China, the Middle East. The United States has Group C as a predominant organism. I'm not going to ask you those types of questions, but I just want you to see the widespread effect that meningitis can have, especially on children. Pneumococcal meningitis, we already talked about, mortality rate 80% in elderly, we already talked about, again, vaccine available for pneumococcal pneumonia. Diagnosis and treatment of meningitis, again, you need to get a sample of the cerebral spinal fluid. The best place to get it is in the lumbar spine. Your spinal cord actually stops developing at about the age of 4, but the spinal column keeps developing. So the vertebral column extends a little bit lower, so it gives you a little space, a little gap from where the spinal cord actually ends and when you get to the sacrum. And so in that space, you can actually insert a needle and draw out a little sample of spinal fluid, usually about the level of L4, L5, maybe a little bit higher in some people. You can insert a needle between the vertebrae. Now, you know the vertebrae stacked on top of each other. But if you get the person to bend, to bow over, you actually create a little gap between the vertebrae. And you can insert the needle in there, and you actually get a little sample of spinal fluid. And that's how they do a spinal block as well. They insert a needle, they pass a little catheter through the needle, they pull the needle out, they leave the plastic catheter in, they tape it down, and they're able to inject an anesthetic in that will numb you, will cause anesthesia from the point where the needle was inserted distally. So usually it involves either the pelvic area down to the lower extremity. It's the same mechanism by which you can actually get a pudendal block in pregnancy, though that involves the direct injection of certain nerves, but you can also have a spinal anesthetic for that as well. But my point being, you get in that space, you can get a sample of spinal fluid. Now, you also got to remember, a person may have meningitis, but then you can also induce a bacterial infection with poor technique, not doing aseptic technique, and inject a bacteria into the spinal column as well, so you have to be careful of that. But you get a sample of spinal fluid, look at it under a microscope, or culture it out on a medium. Again, we talked about listeria already. Listeriosis is a mild disease. We see it in most adults, but can be serious in a person that's immunocompromised. all of these diseases, and I should say, in anybody that's immunocompromised, whether that's from a person receiving chemotherapy, person on steroid therapy, immunosuppressant therapy, received a transplant, typically would be on immunosuppressant therapies. Certain diseases like diabetes and HIV disease can severely compromise a person's immune system. They pick up an infection like listeriosis, and it can be fatal. When infecting a pregnant woman, it often causes an abortion or serious damage or death to the fetus because it can cross the placental barrier. Organisms proliferate inside the phagocytic cells again, and so it can be a very virulent organism. Clostridium, again, as a review, endospore-forming organism, little tongue twister there, common in soil, and again, you've already studied this organism. You can see it in wounds. It secretes tetanospasm, which causes a neurotoxin which blocks the nerve pathway so nerves don't relax. Spasms are extreme. Contraction, that's the name lockjaw, that's where it comes from. Extreme cases, the body bows backwards, upisthonis, and that's the condition that you spasm so hard you can break your back. Death from respiratory failure, again, remember the diaphragm is the largest muscle for respiration, 80% of respiration based upon the diaphragm. If that muscle seizes and contracts, you can't inspire, breathe in, breathe out, then the person most certainly will die from that infection. Tetanus toxoid is the booster you're already familiar with. Clostridium botulitum. The cause of botulism is, again, it's an obligate anaerobe, spore-forming gram-positive bacterium found in the soil and fresh water. Has an exotoxin that produces a neurotoxin that blocks the transmission of nerve impulses across the synapse, causing progressive flaccid paralysis. Symptoms typically appear in a day or two. Most botulism results from attempting to preserving different types of food, but they fail to eliminate Clostridium. Why? Because Clostridium has the endospore. Endospore makes it a little more heat resistant. And there are several toxins of this type. Toxin A, or type A toxin, found mostly in the western United States. Proteolytic, probably the most virulent form of botulism. Type B toxin, less virulent, both proteolytic and non-proteolytic strains. Again, we see this found in Europe and other parts of the United States. And then there's a type E toxin that's produced from a strain found in wet soil sediments, often involves seafood. Organisms are non-proteolytic. Endospores, again, are heat labile, so it can be destroyed by boiling. It's not formed in acid foods. pH is below 4.7. For treatment of antitoxin, there's a trivalent ABE type of antitoxin. Again, now this is an antitoxin. This is not a toxoid. This is an antitoxin. Do not affect the attached toxins. Toxins identification can be done by inoculating mice with suspected toxins. Mice who survive the inoculation are typically protected by type E. You can transmit or use this analogy to be able to find therapy for certain adults as well. Botulism toxin has a commercial use. You may have heard of Botox, the use of Botox, which will relax or paralyze the muscles that cause frowns or wrinkle lines. Now, this is good therapy for frown lines, different from wrinkles from sagging skin. Now remember, the most superficial portion of the skin doesn't have smooth muscle. There are some myoepithelial muscles that will contract certain tissues. That's how we frown our forehead. That's how we squint our eyes. Those are little tiny muscles that actually are attached to the integumentary system. Now, you can inject small portions of botulitum toxin into those areas, and it will relax those frown lines. Okay? But now it doesn't remove wrinkles, which is a common misnomer about Botox. Botox does not remove wrinkles. Wrinkles from the integumentary system, skin has become lax and is stretched. Botox, injecting that in there, there's no muscles for it to paralyze. So it doesn't remove wrinkles. If you got real bad saggy wrinkles, you got to get a facelift. Nothing wrong with that, but Botox doesn't get rid of that. And so a lot of money's been made in doctors' offices by injecting Botox with this false belief that Botox would remove wrinkles. It doesn't. It prevents frown lines. If you have, they call it stork feet, so you squint in your eyes, If you have that, boom. People who smoke tend to get significant creases around their mouth and on their upper lip from smoking a lot, and so you can get Botox around the mouth and relax those muscles, and it will get rid of the wrinkle lines that you see, the frown lines from smoking a cigarette in individuals that frown their forehead. Excellent example of that was, if you want a poster child for Botox, it was Senator Kerry. Senator Kerry, and you could tell when the Botox was wearing off during the political campaign because he had a nice smooth forehead, and irregardless of what he was saying or what he was talking, his forehead wouldn't frown. But when it would wear off and he would make a facial expression and he would significant frown. They had a little article about him on in the AMA. But so it's a great example of what Botox can do. But he had a very pronounced wrinkled forehead, and so the Botox was able to treat that pretty effectively. But just remember, because you're all in nursing or allied health, people will ask you about Botox injections. Remember, it doesn't remove wrinkles, so but it can be used. I don't know of any adverse effects from Botox as far as people having a bad response from the Botox injection, other than if you inject a lot of Botox. So, for example, if a person has a really wrinkled forehead and they get a significant amount of Botox injected in their forehead, and medicine, like anything else, will settle by gravity, and the Botox settles into the nerve that innervates the eye, and then you'll get what's called ptosis, or you'll have an eye that you can't quite open. But now, by the time you get into court to try to sue, which is 3 months down the road, it's wore off, so you can blink your eye again. So, but if you're like a baseball player or something and you got to see the ball, or if you're a boxer or something, I don't know why you'd be getting Botox anyway. But compromise is what you do in a job. Maybe a lab technician where you got to have both eyes to focus on the thing, and you can say that it was improper. But pretty much all the informed consents tell you that the medicine can settle, and so it can affect. The other area, again, if you're injecting around the mouth, and the muscles of facial expression get overly affected by the Botox, you can have some temporary paralysis in the muscle. But these injections usually only last for about 3 months, and after that it usually wears off. You got to get another injection, pay another $1,000. So it's good. So in summary, you can treat it, supportive care, antitoxins. Again, once the person gets an active infection from botulism, typically only supportive care. You can give an immunoglobulin, which would support the immune system, but typically only supportive there. Now, if they do get Clostridium, then you can administer the antitoxin. Infant botulism results from Clostridium botulism growing in the intestines. Wounds from botulism usually result from Clostridium botulism in the wound itself. Those that are different types. Type A, as you can see, is the bad boy, 60 to 70% fatality. The other ones have a much smaller incidence. Another disease that can affect the nervous system, Mycobacterium leprae. We will talk about the cousin of Mycobacterium leprae when we talk about the respiratory system, but this is a form of organism that's acid-fast, and remember, Mycobacterium tuberculosis is an acid-fast organism, and we see Mycobacterium leprae is also an acid-fast organism. Grows in the peripheral nerves and in the skin. Transmission requires prolonged contact with an infected person. So one simple contact typically, and you may have heard of leper colonies. There's one in Hawaii, but these individuals, typically you can be exposed short periods of time. Even direct contact, though universal precautions should always be used, but transmission typically requires prolonged contact. Tuberculoid or neural form, loss of sensation in the skin, is typically the results of being exposed. Leproma or progressive form is disfiguring nodules that you see over individuals that are infected by this disease. Leprosy, sometimes referred to as Hansen's disease for the person who isolated the organism. Probably the only bacterium that grows primarily in the peripheral nervous system. These are just some photos taken from your textbook of leprosy. Two main forms, tuberculoid, which is the neural form, roughly the same as Posse bacillary, which is in the World Health Organization name. Skin cells are infected, disfiguring nodules over the body. Mucous membranes of the nose, one sign, a lion face appearance. The hands are particularly affected. Organisms prefer cooler regions of the body. Progressive to the stage of leprosy indicate less effective immune system. Leprosy is not very contagious. You know, I hate those like almost answers, right? Leprosy is not very contagious, which means leprosy is contagious. Leprosy is not very contagious. Death is usually as a result of complications from disease such as tuberculosis, which can be a comorbid disease that will occur with it. Laboratory diagnosis by identification of acid-fast rods from the lesion. Just basically take some scraping from the lesion, smear it on a slide, do the acid-fast stain, and see if you see any red, what's referred to as red snappers, or little red acid-fast types of organisms. Drug of choice, dapsone, D-A-P-S-O-N. That is a test question. That's a board test question. Dapsone, most effective treatment, a sulfon drug for treatment of leprosy. Rifampin, also test question, is a fat-soluble drug. Fat-soluble diet plus phensamine basically is used for the treatment of this disease. It can be persistent, though. Individuals who are infected by leprosy, the treatment is long-term. A year of treatment, some individuals will still represent with nodules at another point. So it's a treatment, and that's why many of these individuals will isolate themselves because of the disfigurement associated with the disease. And again, it's not very contagious, but it is contagious, and so these individuals typically are isolated from the community. Voluntarily, for the most part, there's no mandate that I'm aware of in public health organizations in public health medicine that would restrict a person with leprosy from being out in the community. But again, because of the disfigurement associated with the disease, these individuals typically self-isolate. So some viral diseases that can infect the central nervous system: polio, poliomyelitis. Poliomyelitis is an informal form of polio. Symptoms usually are a few days, headache, sore throat. In a few cases, you can develop paralysis. Poliovirus occurs in 3 different serotypes. Primary mode of transmission is ingestion of fecal contaminated water. Paralytic cases, the virus penetrates the capillary walls and enters the central nervous system, where it displays a high affinity for the nervous cells. The motor nerve cells of the upper spinal cord, called the anterior horn cells, are particularly affected. In recent years, persons who had polio as children have been showing signs of muscle weakness called post-polio syndrome. I see a few people in a clinic that I work in that have post-polio syndrome that are affected by disfiguring paralysis. These paralysis have occurred earlier in life, never developed. And I actually work with a physician from Africa that has had polio as a child as well, that has a disfiguring paralysis in one of his lower extremities. And because of the muscle weakness and atrophy that occurs as a result of the disease, the extremity never fully develops. Poliomyelitis, treated with the Salk vaccine, inactivated polio vaccine, IPV, inactivated form of the virus. Again, remember, all we need is just the covering of the virus. The outer membrane of the virus, just a piece of it, is the antigen. And if our body gets a little dose of just the covering of the virus, our system will develop antibodies to be able to fight off the infection. Ideally, the best way to prevent an infection and to fight off an infection is to get that type of a treatment. In other words, to receive a vaccine, because the vaccine will provide lifelong immunity against the organism. So the Salk vaccine was derived again from an inactivated form. Vaccine requires a series of injections of periodic booster shots. Never enhanced polio vaccine grown by human diploid cells is now available, often used in immunosuppressed individuals. Vaccines resemble that acquired naturally, but in rare occasions, vaccine itself may cause the disease. Don't usually see that anymore. Probably a mutation from a virulent form. Little rat catching her bad end of the deal. That's too bad. Poliovirus, transmitted by ingestion. Initial symptoms: sore throat, nausea. Viremia may occur in persistent viruses and can enter the central nervous system. Destruction of motor cells and paralysis occurs in less than 1% of the cases. Prevention by vaccine-enhanced inactivated polio vaccine. It just shows you some numbers of when the vaccine was started and initiated early 1950s and the occurrence of the disease. As you can see now, no reported cases of polio, well, up until this year. Who knows where the last case was reported at? Anybody hear that in the news? Anybody followed that? So community of, I was about to say Mormons, not Mormons, Mennonites, with the horses and lived the traditional way. But it's Mennonites, am I saying the name right? You laughing at me. You said, stop laughing at me. But, right? Am I saying the name right? Yes? Okay. Mennonites in northern, I think in the Midwest, there were 2 reported cases this year of polio, and public health responded. Now, it's not like smallpox. You know, if you get 1 case of smallpox, that's a worldwide epidemic. Everybody starts getting vaccinated. But polio is a little bit different because it's not as aggressive. And this is a closed community. I mean, you can't just go live in that community. But, yeah, I'm saying it, Mennonites. It was a great movie, if I may pause here. It's a great movie with Harrison Ford about the little kid. Witness? Is that it? Yeah, excellent movie about that. But anyway, so it's a community that was affected. Not daydreaming. I knew I said that right. Anyway, rabies. Rabies, another viral infection. Rhabdovirus, a bullet shape typically transmitted in the saliva of the biting rabid animal. The virus travels along the peripheral nerve to the central nervous system and produces encephalitis. Symptoms include spasms of muscles of the mouth and pharynx when swallowing liquids. Painful reaction causes an aversion to water, which is the basis of the term hydrophobia, fear of the water that's applied to rabies. The person's foaming at the mouth. Animals with furious rabies are restless, snapping at everything. Some animals suffer from a paralytic rabies in which there's only a minimal excitability, although it may snap if handled the wrong way. Rabies, laboratory diagnosis usually made by fluorescent antibody test, which also you're familiar with. In the early years, Pasteur treated standard prevention of rabies in exposed individuals. The vaccination procedure consisted of injections of dried spinal cords of rabbits infected with rabies virus. Currently, the treatment is an active immunization, much better than how it used to be. The latter is done in the human diploid cell vaccines, which are grown in human diploid cell lines. Not holding you responsible for knowing all that. Indications of anti-rabies treatments are unprovoked attack bites by dogs, cats, skunks, and similar animals. It also is possible to contract rabies by inhalation of aerosols of the virus. That's very uncommon to happen. Typically, especially in the United States, it's related to the bite from one of the animals that's described above. What do you have to be doing to get bit by a skunk? You guys ever been around a skunk before? I mean, not for long. Amen. I mean, come on. I always wonder. Anyway, rabies virus, transmitted by animal bites. Virus multiplies in skeletal muscles, then the brain cells, and it causes encephalitis. The initial symptoms, and again, this is a retrograde fashion. Bite into the tissue, infected by the saliva. The tissue gets infected. The peripheral nerves then pick up the virus. The virus then travels along the nerves back to the central nervous system in a retrograde fashion to cause infection. Fierce rabies animals, we already talked about, a little less restless, highly excitable. And then the paralytic rabies. Animals seem to be unaware of surroundings, pre-exposure prophylaxis, infection of the human diploid cell vaccine, post-exposure treatment, vaccine, and again, immune globulin. Again, it boosts your immune system, okay? Immune globulin will help in the management. And this just gives you a little, this is from your book, just shows virus enters the tissue, saliva from the biting animal. They had to use a dog, come on. And then the virus moves to the peripheral nervous system to the central nervous system. Virus ascends the cord, virus reaches the brain and causes fatal encephalitis. Distribution of where we see most of the cases at, the animals that are involved in it. Encephalitis causes a virus caused by arbovirus or an arthropod-borne virus that are transmitted by a mosquito in the common United States. Horses are frequently infected, and when we talk about encephalitis, Eastern equine encephalitis, Western equine encephalitis, St. Louis encephalitis, and California encephalitis. These do not infect horses. The name encephalitis, again, because traditionally it infected horses. Arboviral encephalitis in the Far East, Japan, encephalitis has similar diseases. Also, many of these can have high mortality rates. West Nile virus was one of the viruses that caused a form of encephalitis in New York many years ago. Fungal diseases of the nervous system. Cryptococcus neoformis meningitis. Cryptococcus basically is a yeast-like fungus that's widely distributed in the soil. Also can be enriched in pigeon droppings. Disease of cryptococcosis is basically thought to be transmitted by inhalation of dried, infected pigeon droppings. Good. Often the disease does not proceed beyond the infection of the lungs, but it may spread into the bloodstream and then into the brain and the meninges. Laboratory diagnosis by latex agglutinins. Remember, agglutinins, you see cells kind of clumped together, be able to make the diagnosis. The drug of choice for treating is amphotericin, amphotericin B, and flucytosine. Amphotericin, pretty tough on the system, tough on the liver, carries the name of amphoterrible because it really causes a lot of tough effects on the bodily organs as well, but it's a drug of choice when treating cryptococcal infections. Arboviruses, arthropod-borne viruses for encephalitis, just as a review. Mosquito is a common organism, and Cryptococcus, this organism is in the soil or in dried pigeon droppings. And, on this slide we have also added dried chicken droppings as well, if you inhale that. Now you laugh, but we have a lot of chicken farms. I was born in Mississippi, and when I was little, if you wanted to make money, you could go to the chicken farms early in the morning and help them catch chickens. And you had chicken poop all over the place, so it was very possible to inhale dried chicken, though we never had dried chicken droppings. But we never had an outbreak of Cryptococcus. So, again, treatment with amphotericin B. Another infection that you can see is trypanosoma. This organism is a disease caused by a protozoa, flagellates. You see that it moves into the cerebral spinal fluid. Symptoms are responsible for an informal form of what's referred to as sleeping sickness. Animals are the reservoir for the parasite. Human-to-human transmission by bites, and insects are more likely than the gambazine-type organism, which causes the disease in more acute forms, running its course more quickly. Can be treated by two agents, ceramin and pentamidine. We'll see pentamidine used in other chemotherapy treatments as well. There's new drugs out now, fluoxetine, that's also used to block the enzyme that proliferates this particular organism. Can be used as well. I'm not going to ask you on a drug treatment for this organism. So, and just as a review, transmitted from animals to human by the tsetse fly. Should be familiar with the tsetse fly as the causative, or at least the arthropod vector for causing African sleeping sickness, the tsetse fly. The prevention is typically by eliminating the vector. Sounds easy, but not always. Parasite will invade antibodies through various antigenic variations, just different organisms there. Naegleria meningiocephalitis. This is an amoebic protozoa found in ponds and streams. I think you already looked at this in your lab a lab or two ago. Naegleria fowleria actually infects the nasal mucosa, can reach and proliferate the brain. Fatality rate of Naegleria meningioencephalitis is nearly 100%. Remember, when we get infections in the brain swells. The brain is inside the skull. The skull doesn't expand. So when the brain swells, the only direction the brain can go in is down, because the foramen magnum is the largest opening in the skull. And so because when swelling occurs, the brain pushes down, the vital nerves that control respiration and cardiac input are at the base of the brain. And so when the brain is pushed down, it cuts off, it pinches those nerves, and so the person will die. And so Naegleria causes significant inflammation in the brain. Because of that significant inflammation, it's 100% fatal. So it's a bad guy. Some nervous system diseases are thought to be caused by what's called prions, and we talked about these guys before earlier in the semester. A number of fatal diseases are known. You have probably heard media reports about Creutzfeldt-Jacobs disease, or Kuru, which is mad cow, a type of organism. International public concern about bovine spongiform encephalopathy, or mad cow's disease, that affects many herds of cattle in Britain, Canada, and other countries as well. They thought they had reported cases in Texas. There have been bans on beef being sent internationally periodically throughout the past several years. So a significant concern. The agent causing the disease are unknown. They do not have any detectable nucleic acid. One hypothesis is it's caused entirely by a protein referred to as the prions. Again, those are the diseases. The one that gets most media attention is the Creutzfeldt-Jacobs and the bovine spongiform encephalopathy, transmitted by ingestion or transplant. Chronic can be fatal in some cases.